I was just depressed all the time. I laid in bed, I laid in the shower and just cried all the time, and went off and on from being sad and sad about how bad I felt to being angry about how bad I felt. And I was in the bathtub telling my husband that I felt like I was betrayed by womankind because I didn't have that perfect pregnancy. It didn't feel like I felt it should have. You know, I thought that, oh, I'm pregnant, you have the glow, and, you know, you feel the kicking, and I just didn't feel that happy. And that's when I first contemplated having an abortion, because I didn't know how I could live like this. How are we not going to be in financial ruins if I'm not working and I'm feeling this sick?
Mood disorders in pregnancy present very much the same as mood disorders that are present during other times of a woman's life. They will have difficulty with sleeping, they will have decreased motivation, feeling down. A lot of times there's anxiety present. There may be relationship issues with their family, and just a general malaise of not really feeling good. They just don't feel good. Very negatively can affect their lives, their relationship issue, or their relationship with their family, and definitely their relationship with their child, and their ability to care for that child.
Me and my husband fought over the dumbest things about grocery shopping, about what we were going to buy, who was going to go. I got upset and wanted him to bring a mattress down from our attic so that I could sleep in a different room, because I was mad at him, but he didn't do anything. He didn't deserve it. And I brought up divorce with him because I was sick of he cared for me, and it was that caring that was almost what I didn't like, you know, because I didn't deserve it. I wasn't nice. And, you know, we struggled through that, and luckily that was kind of a turning point that I realized that, you know, I could potentially lose everything. It's the OBGYN clinic through Billings Clinic with Diane Arcava and Diane Getty. And that's the resource for women that are pregnant and going through a hard time, or just even because postpartum depression is, it's a huge factor. The baby blues is a huge factor. It's very common for women to get that. And so to talk to them prior to that happening, you know, prior to make sure that you're okay, fill out the questionnaires that they have screening for postpartum depression, and treat it. Don't ignore it.
Postpartum depression is definitely a real disorder. We have some very good tools we can use to question women, to have women fill out, where we know there are specific symptoms that do occur in the postpartum period. And sometimes these women have no history of a mood disorder, have no history of depression, and they have a child, and within a short period of time they develop a very significant depression that affects their life very negatively.
The benefits to a patient are that they're seen right in the OB clinic, and we have really good communication with their OBGYN doctor. We also do get referrals from our family practice docs here at Billings Clinic, and we communicate with them as well. And also the doctors can follow along in our electronic medical record to see what we're doing with the patient. They meet with us every month. Diane talks with them about their medication, adjusts their medication. The patient ultimately decides what they're going to be on, what they don't want to be on. Sometimes it takes a while to get somebody on the right medicine. We talk about lifestyle. We talk about the things that they can do to find some recovery from the depression or bipolar or whatever mood problem the patient might be having.
I think that it's important for people to understand that this is not something you choose to have. It's something that happens to you, and there is a resource there specifically for pregnant women to get help, you know, to meet other people who have the same problems they do, and to understand that they're not alone. You know, they're not the only woman that has gone through pregnancy and not been happy, and, you know, I don't know. I think that it's important to know that you're not the only one, because I was so alone with my first pregnancy. I was very much didn't have anybody to turn to. And with the second pregnancy, knowing that I could call the Dianes, and I did call them, and utilized their services and utilized the help that they gave me. So I just think that the message is that there is help out there.